The first thing I remember was Mama hollering and screaming because of the fact that I was shot and I was bleeding. And Daddy had loaded me up, and Daddy knew it was bad, and he loaded me up in the vehicle, and we called the ambulance, and we run all the way to Brewer Grocery, which is a little store up the road where we meet the ambulance at.
Well, once we got about 5 miles from the house, he proceeded to tell us goodbye. He said how much he loved us, how wonderful parents he thought we were, he said, "Mama, I know I'm dying."
TJ needed immediate life-saving interventions. He didn't have time to go to the next biggest hospital that had surgeons or all the bells and whistles that an academic or a large trauma center would have. He needed care in the community where he was, and that's the whole premise of this program, to provide that care in their community so that we can save lives and improve health.
We are located in Lexington, Mississippi, Holmes County, actually one of the poorest counties in the state. We have a shortage of physicians to provide services in the county. The physicians that was here, they are aging, and your younger physicians do not want to move into this county.
Telemergency has provided a very quick access for a physician hundreds of miles away from a patient to be able to walk into that room. And the nurse practitioners function at a level where they can provide all the stabilizing health care that's necessary. Working together as a team now provides that board-certified emergency level care that gets that patient stabilized, resuscitated, and transferred to the place where they need to be.
Whenever you get to tell a patient what you're about to do when you're going over a case with a physician, to see their reaction is great, because they get excited that they actually get to have more than one assessment going on at the same time, 90 miles away, via computer screen and a telephone. And it's a very cool, great feeling to be able to tell them that we have come this far and we're able to do this. Most of them get very excited whenever you tell them that you're fixing to turn a TV on and somebody's going to be able to look at them and talk to them the same way that I have. It's like they think they're on TV.
At the hub site, we have two TVs. One, the point-to-point TV, which is strictly for that patient consult. The doctor can either talk to the patient or to the NP or to the family.
Without that visual, it's very hard to tell somebody, pull here, push here, put traction here. But if you can see somebody do that and demonstrate it, then it allows the nurse practitioner to go in and do exactly what they need to do.
And I was trying to hurry him get out that rain, and I run out the house and just slipped down and fell. And I didn't know my ankle was broke till I tried to get up.
So she came in and there was an obvious deformity to the ankle, and I was able to talk to Dr. Troutman. He was able to come on the screen and talk me through actually it's called a closed reduction, whenever you actually pull traction on the ankle and you turn it inside instead of out, and able to reduce the ankle and get the patient pain relief immediately. But he was able to talk me through that on the screen and able to zoom in on that to see that the ankle was actually reduced.
It was shocking to me because I didn't know they had that out there. Just to pop up on TV and looking right at you and talking to you like that.
We've been doing this for 8 years now, and we've seen over 180,000 patients. Now, many of those the nurse practitioners are seeing by themselves. Not every one is a consult, but they know that if ever they need that physician backup, that person is right there at a moment's notice.
We are the sole provider that's here, so we're it, and it's great.